Good evening. I am Dr. Langston Smith, a member of the Alpha Phi Alpha Health and Wellness Committee. I am a retired endodontist, a life member of Alpha Phi Alpha Fraternity Incorporated, and a member of Iota Upsilon Lambda Chapter, Montgomery County, Maryland. I welcome you to this webinar tonight, where our topic, a comprehensive discussion of prostate cancer and family health. On behalf of our Joan President, Brother Dr. Willis Lonzo III, our Board of Directors, and Brother Michael Smith, Chair of the Health and Wellness Committee, welcome. It is good to have you with us tonight. Working with me tonight is Brother Arturo DeWalt, also a member of the Health and Wellness Committee. Brother DeWalt is a clinical oncology medical surgical orthopharmacist at Texas Health Hughley Hospital of South Fort Worth, Texas. He is a life member of Alpha Phi Alpha Fraternity and a member of Tau Lambda Chapter of North Dallas. At this time, I would like to thank our sponsor of tonight's program, Pfizer Incorporated. Thank you, Pfizer, for your support and for being a partner of Alpha Phi Alpha Fraternity Incorporated. You asked the question, why a discussion on prostate cancer? The American Cancer Society projects that there will be over 288,000 new prostate cancer cases and over 34,000 deaths related to prostate cancer in 2023. The American Cancer Society also discloses that there had been a decline in the incidence of prostate cancer. But since 2014, there's been an increase in the number of cases per year, which is attributed to a decline in the prostate cancer screenings. This projection by the American Cancer Society illustrates why the discussion tonight is so important and relevant. Our presenters tonight, we welcome Brother Anthony Minter and Mrs. Tammy Minter. Brother Minter is the Executive Director of Veterans Prostate Awareness and a consumer advocate for zero prostate cancer. He is a retired U.S. Army flight paramedic, having served 20 years of active duty in the United States Army. He is a member of Alpha Phi Alpha Fraternity Incorporated and is a prostate cancer survivor who has made it his mission to provide support, education, and awareness of this disease within his community and throughout the nation. We thank you, Brother Minter and Mrs. Minter, for this great work that you are doing. And partnering with Brother Minter in his advocacy is his wife, Mrs. Tammy Minter, who has been in the caregiver space for over 11 years. Our program tonight will proceed as follows. We will have a short video followed by a question and answer panel discussion facilitated by Brother DeWalt. Following the panel discussion, we will have time hopefully for questions from the audience. If you have questions, please place them in the comment section. And now, the video.
I walk in, I'm sitting there, she's at her desk. She says, I got good news and bad news. She said, the bad news is you have cancer.
Let us pray. Our God and our Father, we're so thankful and grateful.
And she said, the good news is there's a good chance that we caught it early. And I thought about it and I said, oh, okay. Well, this is good. This is good. And then I got that look. She's like, good. It's like, yeah, now I get to talk about what I am experiencing. Hopefully, I can help some people. For me, I decided on the course of the treatment for prostate cancer. And 9 years later, the prostate cancer is still in remission. That's one of those things where you have to advocate for yourself. There are a lot of men out there that don't even know what a prostate is. Having been in the medical field in the military, I really understand a lot of medical terminology and things that relate to the body. I got to thinking, how many men would be okay doing research and trying to figure out all of the doctor speak? And so I dove in, I tried to learn as much as I could and put myself in a position to be available to talk to men. I started a support group that was for newly diagnosed. Started making a trip to Washington, D.C. to the Zero Summit. Had I not been going to those summits and had the ability to talk to someone about that, I probably still would have been suffering in silence. Give me a smile. You know he can have it on. It's a difficult fight to fight. And if it was not for my family, it would be probably easy for me to give up. My wife showed me what it meant when it says for better or for worse. And there were times when I would say to her, I can't believe you're still here.
So now we get into the real deal.
Even though people call you a superwoman, you still need a support system. And I remember in the hospital one day, I'm in the cafeteria crying by myself because I didn't know what was going to happen. I'm sorry. I'm just glad he's here. And so I needed to do what I could to make sure that he stayed here.
I know that none of us come to stay forever. And I want to make sure that I've done everything that I can do as it relates to prostate cancer. Thus, I aspire to inspire before I expire. That's why I'm here. That's my purpose.
Thank you. What a wonderful testimony, and thank you for sharing. And now we will have our panel discussion with Brother Anthony Minter, Mrs. Tammy Minter, as facilitated by Brother DeWalt.
One of the things that caught my attention was the screening portion that Brother Minter caught this at an early stage. Being in healthcare, one of the important things for men to do is prostate screening. According to the ACS, American Cancer Society, Black men with a father or brother who had prostate cancer when they were younger than the age of 65 should be screening at age 45. Black men with prostate cancer that were before 65 should be screening about 40 years old. And if you don't fall in the high risk categories, you should screen starting at age 50 every year or every other year. So that brings me to the question, Brother Minter, can you tell us a little bit about yourself? Who is Tony Minter? Who is Tammy?
Sure. I am Tony Minter. Like I said, I'm a proud veteran of the United States Army. I am a 12-year prostate cancer survivor now. And I think I owe that to early detection and the screening. Married to this beautiful woman, Tammy. We have 4 daughters, pastor a church, life member of Alpha Phi Fraternity. I stay active. I am deeply into advocacy work, trying to get the word out to men to be screened for prostate cancer, to know what their number is, and this is my life's work.
Great. Tony, can you also talk about your time in the military? What does it mean to be a veteran, and how that expanded your work in advocacy?
Sure. So I stumbled into the medical field. Did not know that was something that was going to be something that really resonated with me. So I stumbled into the medical field and I ended up staying the entire 20 years. I was a flight paramedic, and I also worked in emergency rooms and in places like that where you got a chance to see a lot of trauma. Learning about the human body and learning about medical terminology gave me really good insight on how to take better care of myself, which meant every year I was taking a physical. I had to because I was a flight paramedic. And I wanted to understand what those numbers meant from the blood that they were drawing, what all of the tests meant. I wanted to understand that. So when I got out of the military, I was already in the habit of getting the physical every year and looking at those numbers. So one of the numbers that really caught my eye was my PSA. I would watch my PSA, and in the beginning, it was just a fraction of a percent that it would go up. And then all of a sudden, it started going up double numbers, whole digit numbers. And it got to a point where, because I understood these numbers and what they meant, that I felt like I needed a biopsy. And I was discouraged to get the biopsy by my urologist. She thought it was something else. But you kind of know your body. If you listen to it and you watch things over a period of time, you kind of know your body. So we went and did the biopsy. It came back positive that I had stage 2, 3 borderline prostate cancer. And then I was told, take some time, go do some research, and come back and tell me what you wanted to do about it. So my military career helped me to be able to go and do just that. But I also knew that a lot of men did not have that background that they would go do research and understand what they were reading. My prostate cancer journey in and of itself has been just that. It's a journey. First, you get a diagnosis, then you get treatment, but the real fight begins on your journey. And every man's journey is different. So being in the military and serving my country equipped me with the skills I have now to help men, and not only this fight for prostate cancer, but our overall health. And he blessed me with a partner to be with me on this journey to help save lives.
Okay, great. That brings us to Tammy. Tammy, what has your advocacy work meant to you, and what are the advantages of people connecting with advocacy organizations?
As of now, I truly kind of understand prostate cancer. This started way before I even met Tony. My grandfather had prostate cancer. And I remember he had surgery to have his prostate removed. And we never really talked much about it after that. A few years later, my father told me that he had prostate cancer. And so I think, in a sense, in my mind, I'm thinking most Black men are going to get prostate cancer. And then, too, at that point, I'm thinking, but they'll be okay. After I got married and we found out, later on in our marriage that Tony now had prostate cancer. He wasn't as jolly and excited about hearing he had prostate cancer as it might have seemed on the video. When he first found out about it, I could tell it was really bothering him. And as his mate, I thought it was my job to reassure him that we were in the fight together and that he didn't have to do this alone. And I think with this going on, and after he started doing a lot of work, helping a lot of men with, dealing with their prostate cancer, they had spouses or they had children who didn't quite understand what this process meant. And I think being with Tony, this kind of threw me in there to give my testimony or outlook on what it means to be a caregiver and what it's going to take. When I first started, I didn't know what I needed to do. I didn't know what questions I needed to ask. I didn't even know I needed help. But doing this has given me a new outlook, and I'd rather be here now and to help somebody else get through it.
Great. Being that you mentioned your grandfather had prostate cancer as well. Well, statistically, 1 in 4 Black men throughout their life will possibly have prostate cancer, as opposed to 1 in 6, as opposed to 1 in 8 of overall cancer. Although all men are at risk for cancer, Black men in particular are at a higher risk for prostate cancer. Not sure if everybody know that, but that's statistically speaking. Again, Tammy, from a caregiver perspective, what role do advocacy organizations play for you? What support have you received from those organizations?
When we first found out about Tony and when he started going to his treatment, I didn't get any help. There was no group that came to me and said, hey, what can we do for you? And I didn't know who to ask. And that might be the case for a lot of people right now dealing with this. Who do you go to? How do you even know that there's groups to help you? Honestly, I didn't find out about a lot of the help until after Tony became an advocate. That's when I found out. And that's why today I'm saying there needs to be something. I mean, you can put a pamphlet somewhere, you know, I'm going to say it's not very often that people are just going to pick that pamphlet up and say, hey, let me see if I can find help. Right. So you kind of be in people's face and kind of talk to them, and they got to want to hear it from someone that they can relate to.
Okay. Well, in lieu of that, also, the caregiver role is so vitally important. What role have you played throughout Tony's journey in the treatment decision-making process?
Tony had some good doctors. The doctors encouraged him to bring me to his appointments. And the good part about that is, you know, a lot of things that were going on, Tony kind of didn't want to hear it. I mean, you know, he just wasn't feeling it. And I could hear things that he couldn't. And when I heard it, of course, I'm starting to doing my research as well. I'm Googling, I'm trying to figure out. And there were some doctors I finally asked, could I record you so that I can go back and check what it is I need to check? And they allowed me to record the appointments. And what I did was go home. You know, I looked up all the information. You know, even though Tony, you know, is in remission, he's had a lot of complications from the procedure that he took to get rid of it. So that's been a journey in itself. I don't know if he talks about it much, but, you know, the radiation damaged his bladder. So it was a point where we had to figure out what to do about that damaged bladder. And of course, you know, he's kind of like, it's my bladder. I need it, you know, and I had to go back and do research, and I had to reassure him that, you know, this is going to help you in the long run. It's going to give you a better quality of life. And so that caregiver, you know, you kind of got to look at it as this is cancer for both of us. This is our issue. And I wanted him to understand that whatever he's going through, I'm going through it too. If he's suffering, I'm suffering. And it was my job to bring him back to that happy place where he can live life, you know, and be successful with this.
Yeah, again, early detection was probably key in Tony's, where his health is at this point right now. Was there any chemo involved, Tony, in your treatment so far, or is it just radiation?
It was just radiation, and of course some surgical interventions afterwards. And like you said, the key to that was early detection. Early detection allows there to be more options available to you, and it doesn't have to get to radiation or androgen deprivation therapy and all these other things that are really, really bad for the body. You know, we want to keep men out of that situation. A simple blood test and a digital rectal exam will let you know where you stand. And I've had many men that I've dealt with that were diagnosed at stage 4, metastatic prostate cancer. Your options are less. It's very devastating to be diagnosed at that stage because the prognosis are not good. So all I have now is my testimony, my advocacy work, and facts to let them know, hey, look, you need to get checked. You need early detection. Even if you don't have it, at least you know what your baseline is.
Yes, that's so very important that you said that early detection is the key. Unfortunately for Black men, from a healthcare perspective, we don't go to the doctor. We don't have insurance. And sometimes that's how we end up in a bad situation, which could be 4th stage cancer, prostate cancer. Being an oncology pharmacist, I deal with it pretty much on a daily basis. So I understand stage 1 through 4. And anytime you can detect something in stage 1, 2, or 3, you have a chance.
Yes.
So in addition to that, with so many resources out there, what resources, Tony, did you find most helpful during and after your diagnosis? And Tammy, was there any resources that helped you as a caregiver with Tony?
So I was forced to go out and look for resources early in the game because my urologist told me to go do research and come back and tell her what I wanted to do about my cancer. So first I had to learn what all of those numbers meant. What was the Gleason score? You know, how many cores did I have cancer in? And, you know, what was the numbers? And I had to learn all of that detail. And so I used some of the hospitals like Johns Hopkins, like the Cleveland Clinic, Duke Medicine, the best places for prostate cancer to find out information. Yes, I did use the internet, but I was aware of what's garbage and what's not. So I used the internet. I used the physicians that I knew, and I also looked at pharma. There were several pharmacy websites that had really, really good educational materials about prostate cancer, and I utilized that also. Those are the things that helped me make a decision to learn about risk factors. You mentioned earlier about risk factors, and as African American men, you know, we already have a risk factor just being an African American male. Then you got family history, and a lot of us don't really know our family history, which makes it even more imperative that we get checked out early. And another one that I'm working on now is veterans in the military have a higher risk than the general population, even African Americans. Our risk is even greater. And I know in Alpha, we have a lot of brothers that are military.
Right.
So we have to add that in as a risk factor to encourage men to be checked out.
Right. Glad you mentioned that. Several factors that play into prostate cancer in Black men is genetic, inheriting those biological factors. You also have low enrollment in clinical trials. A lot of drug companies out there do clinical trials to track Black males, but we don't participate in the trials. The other is access to care. And for a number of reasons, insurance, work doesn't give us the access to care. So then there's little to no detection, which puts us at a disadvantage from a screening standpoint as well.
Mm-hmm.
So, but for both of you guys, in both your opinions, what is the largest unmet need for patients living with prostate cancer, in your opinion?
The largest unmet need. I would say it's probably support groups. And I say that because there's a lot of valuable information that you receive in a support group. Also, you have to think about the mental challenges that you go through with a cancer diagnosis, depression, anxiety, stress. All of these different things must be dealt with along your journey. But I've come to discover that there are so many resources out there, printed resources, that can help. And the place that you get those printed resources is through support groups. So I would say having robust support groups is probably the biggest unmet need. Prostate cancer is a journey. And I think I mentioned earlier, you got a diagnosis, then you got a treatment. But the battle and the fight is the journey. Your journey to survival, your journey to quality of life. Anything that can happen to enhance that or to improve that, I think all needs to be part of that support group that can point you to resources that can help you, that can direct you to, because I'm a mentor. So I get calls all the time from all over the country of men who are newly diagnosed, and really they're shell-shocked. They're depressed. They're in a bad way. So having advocates who you can point to and say, this is an advocate, I'm going to connect you together so that you can be on this journey together and to know that you're not there by yourself.
Well, thank you. That's all the questioning that I have for you guys. Brother Langston Smith, we can turn it back over to you and see if there are any questions need to be asked from the audience. Or if there's anything else, Brother Mentor or Tammy, would you like to add to what we've already discussed?
Yeah, I would like to say, when you hear the word cancer, you think, okay, I'm going to die. Prostate cancer in its early stages is probably one of the most curable cancers there is in its early stages, if you can catch it early. And the sooner you get it, the more options are available to you. We have to get out of our head about this fear of going to the doctor, this fear of getting physicals, the big fear of getting a finger to get a digital rectal exam. If you think that that's what's going to happen, then you're probably not going to go to the doctor. And we're saying you don't have to like that, but you got to do it to make sure that you're okay. See, we have to be here for our families. We have to be here for our communities, our kids. And if we are nonchalant about healthcare and what's going on with our body, and we're macho, and we don't think that there's anything wrong unless there's pain, that's bad. Because in your early stages of prostate cancer, I had zero symptoms. I had nothing to tell me that there was something going on inside of my body. So I benefited from going to the hospital, getting that annual physical, and knowing what my numbers were. Right. Men need to be open to understanding about their bodies and the healthcare. And those support groups provide you with a safe platform to talk about that stuff, what our concerns are. My concern was, I didn't want to be incontinent and wearing a diaper. I didn't want to be impotent. And so if you think about all these things that could happen to you, it's going to discourage you from going get checked out. And when you finally have to go because you're in so much pain, it's too late then. Right. We want to get you to a place where something can be done about what's going on in your body. Right. And I've had several alpha men who I talked to, who I've shared with, that heard me, but didn't go. Mm-hmm. And then I get a call. They've been diagnosed. It's stage 4. I'm giving you the best tool I have as a testimony. Right. I'm giving you support. I want to walk with you on this journey. And I think if there's more advocates out there, more men who has been diagnosed and have been treated would come out and start talking about this disease, then it'll make it okay for other men to talk about it.
I totally agree. The key point that Brother Mentor is making is you have to get screened. If you don't get screened, you'll never know. And the procedure has now changed from the rectal exam to just blood work now. So it's even easier to be screened. So there's really no excuse or reasoning not to be screened for this. Could be a deadly disease among Black men.
Yeah. And I'm glad you mentioned the fact that, there are things that are changing in the diagnosis process. Since I've been diagnosed, there are so many treatment therapies that have come on board. There's so many diagnostic tools that are out there that can pinpoint specifically what a cancer is, and they can do focal treatment. I mean, there's so much more going on now in just the last 10 years.
Yes.
That is amazing. And another thing that you mentioned earlier was clinical trials. And that's part of the work that I do also, is to try to encourage African Americans to participate in clinical trials. And I always hear Tuskegee. I say, well, tell me about Tuskegee. And they don't know. So it's this thing that they've heard about, but they don't really understand.
Right.
And clinical trials today isn't what it was before. And if they come up with all of these different treatments, how do we know it works for us if we didn't participate in a clinical trial? And the way I look at it is, the life I saved might not be mine, but it might be those men coming after me.
Absolutely, 100% agree with you. You've got to participate in trials. You have to screen. That's the only way. No other way.
And I also want to give kudos to my wife as a caregiver, because she didn't really tell you how much she saved my life, and she loved me back to life with her actions and her behaviors. And some of the decisions I had to make about my treatment, um, it got to the point where I depended upon her and her opinion in my choice, because I know she did the research. I know she had my best interest at heart. She knew who to talk to, how to talk to them, how to get the information out of there. And she also tried to shield me from things that she knew would mentally depress me.
Right.
She was in those rooms with me when I was going through some very, very difficult stuff that no man wants a woman to see. She was in that room with me. I thought that not being the man who I was when we first met was a big thing. She assured me that no, that's important to you, and there's so much more that goes into being a caregiver, than just changing your diaper, or when you can't. There was a point in time I couldn't even walk. I couldn't do anything for myself, and she did that. So I am who I am today and how I am today because of the input that she had on my life as a caregiver. And caregivers are so important in this journey. They're so important.
And I want to commend her for that, because I deal with it on a daily basis. Families, being an oncology pharmacist, and that's a tougher job than the patient themselves sometimes.
Yeah.
So, well, Brother Langston Smith, we can turn it back over to you from here. Well, we may have lost Brother Smith. I'm not sure if we have or not.
Okay, here we are.
Okay.
All right. Thank you, Brother DeWalt, for leading and facilitating that discussion. Thank you, Brother Mentor, Mrs. Mentor. And I do have some questions that have come in. The first question, Brother Mentor, in addition to the PSA abnormality, did you have any other symptoms?
Yes, there was absolutely no other symptoms. I had no urinary retention. I had nothing. I had nothing that would indicate to me that I had cancer. And that's how it is usually is in its early stages. You really don't have any symptoms. And what they try to do is they try to rule out, in the large prostate, maybe that causes your PSA to go up. Do you ride motorcycles or bicycles? That'll cause your PSA to go up. Did you have sexual intercourse within 72 hours? That'll make your PSA go up. So they tried to rule out all of that. But as far as signs and symptoms or anything that would indicate that there was something going on, I had none of that.
So that really goes to the point that we should be regularly screened to facilitate the awareness of this disease. Okay.
Absolutely.
Another question that came in: talk about your prayer life and the impact that it had on your journey.
Oh God, my faith is everything. My prayer life got me through some of the darkest moments, but it also gave me the feeling that no matter what, everything was going to be okay. I always say, like Paul said, for me to live is Christ, but to die is gain. That's my motto. Either way, I'm okay. But as long as I live and while I'm here, I know that there's work for me to do. And what Tammy and I do, we look at this as a ministry. We look at it as a ministry. He's opened this door. He's taken my tragedy and turned it into triumph to be able to help men in this prostate cancer space. My prayer life and my faith is everything.
Okay. Mrs. Mentor, would you like to add anything to that?
The prayer life has really gotten us through this. Not just prayer, but God's got us through this. You know, even while Tony was going through his cancer and whatnot, as I said earlier, my father was going through at the same time. My father's cancer came back, and I remember Tony was doing I think it was a health seminar. And while he was doing that, I had to fly to Chicago to see my dad take his last breath from prostate cancer. So it really means a lot to me that, you know, the men I love or, you know, that I know, please go get checked.
Okay. All right. Thank you. Yeah, Brother Mentor, you mentioned that you did a lot of research and you reached out to Johns Hopkins. And as a veteran, did you get any resources from the VA?
Unfortunately, the VA at that time, we're talking 11, almost 12 years ago, they didn't have many resources in the VA. So I had to get my care outside of the VA. I ended up going to Atlanta, Georgia for my treatment. It's gotten a lot better, but look at radiology delivery systems for treatment. We got 171, 72 VA medical centers. Only 32 of those med centers have the capability of delivering radiation treatment. So it has to be done outside of the VA. And I think that there's a program called the Community Care Network that you have to, you know, sign up for to go outside of the VA and get the treatment. You know, when they tell me at the VA to go out and do research and come back and tell me what you want to do, that's not a good thing to tell a patient who you just told they have cancer.
Okay.
And that was the VA at that time. So it's gotten a lot better since then.
I see. All right. Well, thank you. Another question. What can the fraternity, Alpha Phi Alpha, do toward this advocacy and awareness related to prostate cancer?
I think one of the things that would be good is all of our conventions that we have, regional, district. We need to have a presence, have a table there to give out materials, to talk to the brothers, to encourage them. And I would also say at your regional and national conventions, have an opportunity for brothers to be screened,
Okay.
to get a PSA test done if they haven't had one on site. I think that would be a huge help in helping the brothers of our fraternity be better, in a better position to deal with it if it becomes that they have prostate cancer.
Okay. When Brother Lanzer, Brother General President Lanzer became president, he initiated a program, the Surgeon's Journal Initiative. Are you aware of that initiative and what that group has been doing?
Yes, I'm aware of it, and I've received several of the flyers of work that they're doing, and some of the seminars that they've held. I've gone on and listened to them, and it's a good work. But I think with anything, we have to figure out some kind of way to encourage the brothers to tune in. You can have all of the greatest seminars and videos available, but if the brothers are not watching it, it's not going to really be that effective. We got to find a way to encourage brothers to tune in, either during the live sessions or even after the fact, so that they can get this information.
Okay. Thank you very much. And we will definitely take that into consideration, because I think the work that they have been doing has been great. And we do have to get the word out to the brotherhood and to the community to listen to those webinars. Okay. There's an old saying that an ounce of prevention is worth a pound of cure. What is your message to young men in their 30s regarding health care and wellness practices as a preventive tool to prevent prostate cancer?
So it was mentioned in my bio that I'm the executive director of the Veterans Prostate Cancer Awareness. And out of that group, we created a checklist that starts at age 20, that goes all the way up to 70, 80 years old. And it tells you at what age, what checks you need to get done what physicals you need to get done, what screenings need to happen. And I think this checklist, if it's followed, then they're on a pathway to better care, to better management of their health, because it tells you at every age what you need to get done. It's been approved by some of the greatest minds in medical, uh, the top doctors. They reviewed this document before it was done. And I say, get it, put it on your refrigerator, show it to your spouse, and have your spouse to enforce it, um, to make you go or to take you to the doctor, because you can have that and you still won't go. We got to depend on our spouses to make us go. But there are resources out there that are available to encourage you to go to the doctor. I always say, real men, check it out. Real men, check it out. Think about our families. Think about how much more we can do as healthy men, and let that guide you in your decision making as far as preventative care. We need to be proactive versus reactive.
Okay. All right. Well, thank you. Thank you so very much for those answers. And as we address the questions that came in, those are all the questions that we have in our comment box. I don't see any others coming in at this time. So, Brother Mentor, Mrs. Mentor, thank you so much. We appreciate the job that you're doing, your journey that you're sharing, the awareness and advocacy that you are doing. And we think that this is a role that has great importance, and you're commended. We commend you for what you're doing throughout your local community and as you reach across the country. So thank you very much. And thank you for participating on this webinar tonight. Brother DeWalt, thank you for your assistance, your cooperation, and in facilitating the discussion. And I would like to thank Pfizer again for supporting this webinar and for being a partner with Alpha Phi Alpha Fraternity. So with that, ladies and gentlemen, we would say bid you good night.